Okay, well look, it's great to be here today. I'm enormously impressed that you're all here. It's very difficult to get anything started before 9:30 in London if the sun's shining. So the fact you're all here at 9 o'clock and it was snowing just about everywhere is absolutely brilliant. What I hope to do is to just briefly go through why this government thinks community budgets are important. Why it thinks families with complex needs or families with multiple problems are important, and what we hope community budgets for families with complex needs will achieve. If I kick off just as some general context, we've all heard of the big society matched by big citizens. A big society is something that you live in. It's not something that government creates. It's about your experience as a member of that society. So whether you feel a part of that society, whether you feel that the people around you and the services around you are yours and are there to meet your needs, and whether you are a part of supporting that, is very much a personal experience. So within government, on the right-hand side there's the sorts of things that were in the Public Services White Paper that suggest the things that government are doing. But actually, they're, in a sense, things government's going to stop doing that will create the opportunity for people like you here to make the sort of difference that Carl was describing within Hull. The sorts of things that I suppose we think are likely to happen, clearly there has to be a real shift from the sort of centrally driven approach where government in effect commissions local areas to do things, very much something that is locally driven to respond to local needs, focused on outcomes, what actually happens, rather than delivering certain numbers of X or certain numbers of Y. Much fewer funding streams and accountability frameworks. That is beginning to happen. The local authority allocations that will come out next week, we hope. The increased opportunities for pooling and flexibilities. Key within that, obviously, is to do more for less, and improving coordination, removing duplication is key to that. But very much approaches that are led by the sector, much less top-down, much less national organisations involved in supporting local delivery, local areas working with each other, peer support, and much greater involvement of voluntary sector, social enterprises, even private sector investment, volunteers. So a much more diverse range of providers, and within that more cost-effective practices, service redesign, and I am sure in the discussions that you have over the next couple of days, there will be things around this area that you will be considering. Community budgets. I think it's worth saying that community budgets are a really big thing. Carl was saying why he felt they were a big thing for Hull, but actually they're a very big thing for government as well, because in a sense what government and what Whitehall departments are doing is they're taking a big gamble. They're saying, and it's very difficult for ministers in individual departments and civil servants to do, is to say, well, okay, we really will let local areas do what they think is best to achieve their outcomes. And that, I know, can be very scary if it's you that's doing it on the ground, but it's also very scary if you're a minister responsible for delivering a particular outcome and you're giving all your money away and you're giving all your powers away. Nevertheless, without a clear mechanism for delivering the kind of change that's needed on the ground at a national level, that has to happen for local areas to do it. So the 16 areas that are doing it, everyone is going to be looking very closely at what they learnt and what works, because the plan is for a national rollout, but it's a national rollout built on the success of what happens in places like Hull. I mean, you probably are aware of the process that's gone on that has led to the creation of community budgets. And that has involved a wide range of local authorities. It's involved concerted lobbying by the LGA. And it's essentially about putting all the money in one place so that the delivery of services is accountable to local people. It is still accountable to Parliament, but based on the needs of a local area, the ambitions of a local area. And the spending review on the 20th of October, for the first time, gave a commitment for that way of working to be developed first in the 16 areas, 28 authorities. About the same time, within the spending review process, work that we had led in the Department for Education, but working across government, was making very similar arguments. And our arguments were essentially that the most vulnerable people in society and the people that receive the greatest level of support and the people that generate the greatest level of concern for local agencies are those that not only have the worst outcomes and generate the most local expenditure, they're also the ones that get the most ineffective model of service provision. Because what government does is it targets all of the problems through all of a whole range of different agencies. So in effect, what you have is this family, each of these arrows represents a different professional, a different individual that's knocking on the door to try and sort out a problem that one family member has. And all the evidence says this is massively ineffective. It just does not work. It's totally confusing. I mean, I like the analogy, just if on the other side of the wall, of someone who had to repair their car but had to go to a whole range of different garages to get a different part from each garage. I mean, I think the reality for the most vulnerable families is that, but that on the basis that A, they don't know what's wrong with the car, and B, they're in Bratislava and can't speak the language, because that is the reality of trying to negotiate your way around this range of agencies. So there were two themes that were coinciding, and so that is why the decision was taken to take an area where there clearly need to be a pooled, joined-up solution and link it with community budgets as a way of demonstrating that community budgets and local flexibilities really do work. Families with multiple problems, families with complex needs, we haven't sought to closely define what they are because it's very much up to local areas to define what it means for them. What has been done is a fair amount of quite well-known research that's looked at multiple deprivation, and there's about 117,000 families in the country that have 5 or more sorts of deprivation problems. About 46,000 of those will also have children that experience serious problems. And it's this group that will have the most impact on local services. And if you look at a national level, you find that this group is responsible for about 2/3 of permanent school exclusions. The parents are 34 times more likely to need drug treatment, 8 times more likely to need alcohol treatment, and so on. So if you intervene with these groups, and if you successfully support these groups, for quite a small number of people in each area, a few hundred people, then you can have a measurable impact on certain outcomes, and often the outcomes that there is the greatest social concern about. So the types of problems affecting the families, none of those will be a surprise. Anyone that is working with vulnerable families will recognise that collection of problems. One of the things that I think tipped the balance in the spending review process was work that we did to say, OK, how much does it really cost? And what this shows is, well, it shows that on these families, nationally, we're spending about £0.7 billion a year in providing them with exactly the same services that everyone else receives. And then we're spending about £0.8 billion providing more targeted services. So benefits, health treatment, and so on. Then, on top of that, about £2.5 billion in responding to the things that go wrong. Now, this could be taking children into care. It could be criminal prosecutions, evictions, and so on. Now, the £2.5 billion is actually benefiting no one. Well, it might separate individuals from children they could harm or from communities that they're upsetting, but it's certainly not resolving the problem. The £0.8 billion targeted spend might be, but we know the way it's provided isn't effective. And the universal spend probably isn't, because in many cases it's not taken up by those individuals anyway. So what do we know works? Now, clearly there is an awful lot about how a service is provided that will impact on who uses it. If people think it is their service, they feel some ownership and understanding of the service, it's for people like them, they are more likely to use it. But for the most vulnerable families, we know that they're the ones, all the research says, that are least likely to use services. And the only proven way of engaging families effectively in services is through one-to-one contact with an individual that they build up a relationship with. So although responding to families with multiple needs can be an extremely broad range of service changes, at the core of that is one-to-one support from an individual over an extended period of time. And the research that's been done on family intervention projects which operate around, there's around 300 over the whole of the country, and various local variations of those that do exist, have showed that the longer you support the family, the better the outcome. So this often means one-to-one support for at least a year. If the aim is to move on and get families into work, probably 2 years. With enough time spent with the family to make a difference, which means low caseloads, working with the whole family, not just individuals, and looking at what the family's strengths are. Because at the end of the day, people who live in families, the people that are most important in their life are their family members, that however poor people might think they are as parents, or the practitioner might think they are as parents, they still want to do the best for their children, and will do their best if given the right support and encouragement. And then the advantage of having one-to-one support is it's someone that can then negotiate the relationship with the other kinds of specialist support that people might need. There's a lot of evidence around the costs of doing this, but what is clear is that it delivers significant reductions in demand on other services that can be realised as cost savings. And it does that within the same financial year. There's about 90 authorities in the country that have been funded to provide these sorts of services by social housing providers and housing associations, simply because it's cheaper for them than housing enforcement and eviction. They make those savings within the year, and what is interesting is the number of authorities that are exploring other funding sources, actually looking at the potential for generating short and medium-term cost savings, because effective support of these families reduces the demand, particularly on the services that are paying that £2.5 billion of costs. So, on the 20th of October, the Spending Review announced a new national campaign to support families with multiple problems, but a campaign that is driven through the rollout of community budgets as the best way of providing a local mechanism for drawing funding together, because the benefits are spread across so many different agencies. No one agency is ever going to fund one-to-one support for every family that needs it within an area, but collectively the agencies that are currently supporting those families, probably not very successfully because they can only support one problem that that family has, collectively that provides the resource both to support the families and to generate significant savings. There are another 20 areas where other kinds of local flexibility are being explored, and there is also a core of funding that will fund, we think, maybe a third of what it would take nationally to meet all of the families' needs, but a new grant that will be announced by my department in the next week or so, well, alongside the local authority allocations, the early intervention grant, that will replace a whole plethora of different grants. Inevitably, within the current context, the sum of all the different grants will be a bit less, but it won't actually be significantly less. I mean, this is a big grant that will provide local areas with the freedom to allocate their funding for early intervention and prevention work, including work with families with multiple problems on this basis. So, why do we think this will work? Well, as I've explained, it's about the disproportionate contribution these families contribute to poor outcomes, the fact that there is practice that has been shown to work, the fact that the way we currently fund this work is spectacularly unsuccessful, that community budgets overcome that and provide the potential for a more integrated approach for service redesign. And it also removes barriers to completely new ways of funding, of attracting different investment, involving the voluntary sector, volunteers. And then finally, the kind of things that it will be useful for you to say to us in government, but also to say to yourself, what should government be doing to enable this to work? Perhaps more importantly, what should we stop doing? And then in terms of your discussions here, what are the funding lines? What are the accountabilities that you want changed, altered, removed? What's your ask as specifically as possible to government? And then how are you going to evaluate it to see whether it's working? How are you going to show that what you're proposing is going to be better than what is currently there, both to government in terms of getting individual departments to agree those changes, but also to your local partners in providing the evidence that they will need to invest and continue to invest. Thank you.